Hi, my name is Sofia Correa, and the topic of the day is bariatric surgery and the prevention of diabetes type 2 in obese people. We are going to start with the definition. So, what is a bariatric surgery? A bariatric surgery includes a variety of procedures performed on people who are obese. Weight loss is achieved by reducing the size of the stomach and gastric band or through the removal of a portion of the stomach, or by resecting and rerouting the small intestines to a small stomach pouch, which is called the gastric bypass surgery. So here's a little video about bariatric surgery.
Bariatric surgery is the treatment of obesity. So that encompasses a lot of options. There can be a medical management of the obese patient, and there is a surgical management of the obese patient. If you are interested in a surgical procedure, then we have 3 different operations that can be performed to manage obesity and get you back to a healthier weight. Basically, we focus on 3 different types of bariatric procedures. One of our options is called the laparoscopic gastric bypass, where you would make a small pouch about the size of a half a cup, and then we would bring the small intestine up to that small pouch. That's a procedure that's very effective at weight loss. It will cure diabetes, and that's a procedure that you may choose. The food does not go directly into the stomach, but bypasses it and bypasses part of the small intestine so that there is a malabsorption, so you don't absorb as much of the food that you eat.
So as you know, that's the first choice of the different type of bariatric surgeries. Now, what happened was that this was a study made by the New England Journal, and a little bit about the study is that about the background is that weight loss protects against the type 2 diabetes, but it is really hard to maintain with behavioral modifications alone. So this is an analysis of data from a non-randomized prospective control study, and they examine the effect of bariatric surgery on the prevention of type 2 diabetes. Talking about type 2 diabetes, here's a little bit more about the disease.
Type 2 diabetes occurs when your pancreas does not produce enough insulin, and your body is resistant to the insulin that is produced. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. During the digestion process, the carbohydrates from your food are broken down into glucose. Glucose is absorbed into the bloodstream, where it is carried to cells throughout your body. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body's cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain a healthy blood glucose level.
So continuing with applications in medicine, the results. During the following up period, type 2 diabetes developed in 392 participants in the control group and 110 in the bariatric surgery group, corresponding to an incident rates of 28.4 cases per 1,000 persons in years and 6.8 cases per 1,000 persons in years. So the effect of the bariatric surgery was influenced by the presence or the absence of an impaired fasting glucose. So they finally came to a conclusion, which was that bariatric surgery appears to be markedly more efficient than the usual care in the prevention of type 2 diabetes in obese persons. So what are the pros about this different type of surgeries? The first one is that effective weight loss. As for obese people, they actually need it, and also you can get a side advantage, that is the prevention of type 2 diabetes. There's also the advantage of having a reduced mortality and a reduced morbidity. That includes the different diseases. To show you the efficacy of these different surgeries, I downloaded a video about a person that actually had a gastric bypass, so you can see the difference. Here's at the start of his journey. As you can see, he's overweight. This is pre-surgery. He continues to show pictures showing the side of his body and the front part of his body. So he shows that surgery date was May 8, 2009. And you can see the surgery incisions here. Here they are more healed. As you can see, there's already a difference in his weight. You're going to be actually pretty shocked at the end. Here, big difference. He's getting a little bit more tan also. And he continues to get tanned. There's a noticeable difference in weight here. So 2 years post-operation. Wow, so that is pretty amazing. So as you can see, there's an actual weight loss. So continuing with the presentations, we're going to go to cons. The disadvantages of this surgery is that there is a high chance of having surgery complications. There's also a chance of developing gallstones post-operation, osteopenia and secondary hyperparathyroidism, nutrition derangement due to the deficiency of micronutrients such as calcium. So what do you tell people before they get the surgeries about their complications?
This is a procedure that, in the strictest term, it's a very elective procedure. It's not like appendicitis that tomorrow, if you don't do it today, your life is in danger. Therefore, elective procedure, at least I feel obligated to mention at least the serious complications. They need to know going in upfront, even if it's a less than 1% chance. And by the way, these days we've done so many of these that we've gotten good at that the complications really are not as they used to be. I've done probably 1,500 cases. I can tell you that complication rate is probably 1 to 1.5%. But going back to it, they need to know. I don't want somebody blindfolded, taken, and have a procedure, and then, oh, by the way, you got this.
Exactly. So before you actually make a patient or influence in their decision, you have to always mention the side effects. In this case, are the complications. And to finish the presentation, we have a related disease, which is the secondary hyperparathyroidism, and this is caused due to the low levels of calcium. So the causes are also vitamin E deficiency or chronic liver failure. In the symptoms, you're going to have fragile bones, kidney stones, abdominal pain, including excessive urination. Hyperparathyroidism overview.
There is a disorder called hyperparathyroidism, where the patient is making too much parathyroid hormone. As a result, they will often have very high levels of calcium in the blood. The most common cause for this is called primary hyperparathyroidism. And that's a condition where, for reasons we don't quite understand, one or more of those parathyroid glands becomes enlarged. Starts making too much hormone. The elevated hormone level causes calcium to come out of the bones and into the blood. Quite often, people who have hyperparathyroidism don't have any idea that they have it. It's found very commonly when the person has routine blood work and they're found to have a high calcium level in their blood. Further testing then is done and identifies what is the cause of that high calcium level. People who have hyperparathyroidism may have symptoms, and the common symptoms are kidney stones, abdominal pain, stomach upset for no apparent reason, bone pain, muscle aches.
Yeah, bone pain, especially, they become very fragile.
People who have hyperparathyroidism can go on to develop other medical conditions like osteoporosis, pancreatitis, and kidney failure. So surgery is often recommended. Surgery is in fact the only treatment option for primary hyperparathyroidism.
So that was it about this presentation. Thank you very much.